Hello, I'm Dr. Lorenz, and thank you for joining me today. You may have noticed that I've been absent from this venue for a couple of weeks. And for full disclosure, I've needed to unplug a bit. I have felt afraid, discouraged, and physically and emotionally fatigued. So I needed to avoid the repetitive news feeds and have some open, unscheduled time. It helped, and I'm back to reconnect with you, update our coronavirus status, consider the importance of fear, and to again increase our vocabulary with a new concept, decision fatigue. We've just celebrated the 4th of July, and usually that conjures up happy memories of fireworks, barbecues, parties, carnivals, and other large gatherings. This year was different. We weren't as free to participate in those usual celebrations, and it gave me time to ponder what Independence Day means. Being independent means being able to take care of your own needs and make your own decisions without the influence or control of others. Truly worth celebrating. But if we remember the interconnectedness which is inherent in this world, we cannot truly be fully independent. Or perhaps a better way to say it is that with freedom and independence comes responsibility. For you to have freedom from the disease of coronavirus, you depend on me to stay at home when I'm ill, and to wear a face mask when we meet in the grocery store, and so on. And that may be infringing on my absolute personal freedom. And maybe that's the deal, that there are no absolutes if we are to live together on this planet. Some may see caring for others and our planet as limiting their personal freedom. I feel strongly that falling short of perfect freedom may be the best for the health and well-being of all of us. Dr. Anthony Fauci spoke before the Senate this week and was quoted saying, "I don't know how to explain to you that you should care for other people. We are an interconnected community and an interconnected world, and our own health is absolutely dependent upon us caring for others and taking those steps which we know protect others' health, because ultimately it absolutely protects our own." At the time of my first blog on April 5th, the state of Arizona had 2,269 cases of the new coronavirus, and Pima County had 372 cases. On the day the stay-at-home mandate was lifted, May 15th, the state of Arizona had 13,169 cases, and Pima County had 1,750 cases. As of July 4th, the state of Arizona now has 94,553 cases of COVID, and Pima County has 9,313. On May 15th, the state of Arizona reported 651 deaths from COVID-19, and Pima County reported 155 deaths. As of July 4th, the state of Arizona reports 1,805 deaths, and Pima County reports 282 deaths. Intensive care unit bed availability in Arizona is dire. The ICU bed status on May 15th was 72% capacity, meaning that 72% of all ICU beds in the state were filled. On July 3rd, they are now at 90% capacity, with a total of 171 available ICU beds in the state and 8 available ICU beds in Pima County. Though not official, I just read this morning that there are now no ICU beds in Tucson, and we are transferring ICU patients to Phoenix. Our situation is indeed alarming, and fear is very normal and human response. But fear is important, though. It helps us to recognize that there's a problem and helps us instinctively take action to protect ourselves and those we love. It helps us to remain diligent and helps to prevent complacency. So how afraid should we be? With the evolution of the new coronavirus pandemic, the recommendations have shifted, and sometimes they're quite conflicting. It is clear that safety and economic stability cannot be mutually exclusive. And with our current political chaos and delayed community guidelines, it's also clear that the role of individual decision-making is now more important than ever. We will never have a no-risk situation. We must now focus on reducing the risk as much as possible, just as we do with other kinds of daily dangers like driving a car or riding a bicycle. It's estimated that the average adult makes at least 25 decisions by the end of breakfast. And at this time, that number is multiplied many times. We've talked in the past about quarantine fatigue, and now meet its cousin, decision fatigue. As we try to safely keep our homes running, and now as we plan to return to school and to work during this changing time, there's an overload of information coming at us, and we can become overwhelmed by the decisions we have to make every day. Do I have a clean face mask? Is this a good time to go to the grocery store? What's the safest grocery store? Is takeout food safe? Should I visit my family member who may be ill? Is it safe to get together with my friends? Is my cough just allergies, or could I have COVID? This ongoing daily pressure to pay attention and actively make decisions which may affect our health and the health of our families, friends, and neighbors can be exhausting. This level of cognitive processing takes energy and can be draining. Decision fatigue symptoms include irritability, frustration, physical and mental fatigue, anxious thoughts and ruminating, apathy or callousness, or interrupted sleep. It leads to less impulse control and less enlightened decisions, or to decision avoidance. Because we are all different, it's important to recognize your own symptoms of stress and to take action to mitigate your decision fatigue so that you can continue to make the most informed and safest decisions for yourself and others. Let's talk about some ways that you can use your decision-making energy most efficiently and prevent or treat decision fatigue. Number 1, automate the process as much as possible to reduce the number of decisions you have to make. Create routines like washing your face mask when you get home at the end of the day, and have a clean face mask waiting by the door. Keep a grocery list to make grocery shopping more efficient. Always have hand sanitizer and cleaning wipes on your list to take advantage of their availability and to maintain your supply. Choose a day and time each week to go to the grocery store, and batch your errands to limit the trips out of your home. Have regular days and times for home or work chores. Set the same day each week for house cleaning, as a clean house makes us all feel better and resets the energy in your home. Batch your work activities. For example, plan Monday, Wednesday, Friday for reading and responding to emails and for meetings. And have Tuesday and Thursday perhaps for creative activities. Schedule a few hours for healthy food prep for the week. Make daily to-do lists and meal plans. They simplify things and decrease the number of decisions that you have to make during the day. It's also satisfying to place a check mark or cross things off your list when completed. I remember that President Obama wore only blue and gray suits while he was in office as a way of paring down the number of decisions he needed to make in a day. Number 2, build a buffer for yourself. With the adaptations that we're needing to make, things just take longer to complete. Allow for that. Also, allow that buffer in your psyche as well, so that you have the physical and mental energy to make effective, productive, and healthy decisions for yourself and your family. Factor in rewards. Congratulate yourself for steps you're taking right now to improve your safety and that of your community. Wearing a face mask in public, washing your hands frequently, using hand sanitizer when hand washing isn't possible, practicing physical distancing regularly, staying home if you're ill. These are powerful behaviors, and it's important to recognize when you're practicing them well. Acknowledge when you've handled a tough situation the best that you could, or when a decision that you make turns out to feel like the right thing to do. Maybe getting takeout allows you not to have to think about dinner for a night, and you're supporting a local restaurant at the same time. Feel good about that. Take time to discuss some of the oncoming information with trusted friends and get their thoughts and opinions. Collaborative decision-making reduces the risk of personal bias and often results in better decisions with less cognitive load and is therefore less fatiguing. Simplify by saying no to obligations which weigh you down. Make your yeses count by not doling out too many commitments. Perhaps for you that may mean a social activity only once a week, or saying no to a new client or a project when you already feel maxed out. Decisions about your activities during this pandemic may feel complex. To help with that, I've attached in the email that this video is attached to a chart created by the Texas Medical Association to simplify your decisions. Different activities are rated in terms of their COVID risk from 1 to 9. I recommend you try to keep your risk at levels 2 to 3 if possible. Number 6, identify and pursue intrinsic motivators at this time. This means connecting with your passion, love, and curiosity, which are genuine and deep-rooted and offer contentment and joy in a more prolonged and permanent way. Extrinsic motivators such as financial gain or social approval come from outside of us and bring only short-term gratification. Taking on a project for financial gain is not as deeply rewarding as doing it because of the passion and energy you feel while working on it. Next, often it's important to decide not to decide. Not every decision needs to be made today. We don't know what schools, workplaces, and shopping will be like in the upcoming weeks and months. Though the unknown can be anxiety-provoking, it does not help us to ruminate about the future today. More information will become available and will be needed to make the best decisions at the appropriate time in the future. Number 8, eat healthy, well-balanced meals. And you may need more frequent healthy snacks during this time of increased decision-making. When blood sugars are low, mental clarity and self-regulation decrease, and decisions are less astute. Judges are found to make their worst decisions just before lunch. It's important to grab that hearty snacks like raw nuts, nut butters, hummus, or avocado at this time. Don't ever let decision fatigue wreak havoc on your life. Take steps to reduce its impact so that you can make the best choices with clarity and confidence. In past vlogs, I've mentioned some of the positive outcomes of this pandemic, from the chance to slow down and reconnect with ourselves at a deep level, to the dramatic way the pandemic has brought together the greatest minds throughout the globe to create solutions which benefit all of us. Another very positive outcome of this viral pandemic has been the opportunity to connect with you, my patients, in a more human and natural way. When we meet or speak on the phone, I usually begin by asking, how are you? How are you coping? And often before we finish, I'm asked very deliberately, and how are you? And how is your family? I feel free to answer openly because it's obvious to both of us that we are together in a history-making experience, and this allows a level of connectedness that we've not known before. We are absolute equals in our vulnerability to this virus, and that highlights our likenesses and dims our differences. I want you to know that this connectedness has helped me address the challenges of this time. And I hope it helps you to feel a little less isolated and a little less lost. If so, we can all be extraordinarily grateful, and that's a good way to be. Again, I send you blessings of safety, contentment, joy, and beauty, and I hope you feel it every day. Thank you. Bye-bye.